This guy's about to stop and running.
Insert an ad during break. Yes. Okay. Yeah. Welcome, my guys. Welcome, my people. Today, it's a good day. It's a good day on Thursday, and we are talking about epilepsy. We are still continuing with epilepsy. So, welcome everyone. Welcome everyone to the chat. Welcome everyone who is watching Benjamin the Wise Guy. At every region that you are, every place that you are, welcome. And as we usually do what? Talk about medical issues. You see, when you see Benjamin the Wise Guy, what do you see? You see medicine, you see advices, you see good mental health. Those are the things you see. So if you are there chilling at work, you are about to go home, or it's morning driving to work, wherever you are, welcome to my channel. This is a place that you reach and you start feeling good without taking drugs, just talking, advising people. That is what we do here, and advising each other. So you who is there, it is your first time watching me, drop your subscription there, drop your subscription, give me a like, and then tell me at the church, where are you watching me from? We talk about many things in this channel. We talk about something like mental health, how to live well without taking more drugs, how water is important, different things in life of medical health. Those are things that we talk about here. So we have been talking about epilepsy, and if you are watching me right now, you are a new person, subscribe, hit the subscription and stay around. Listen to what we got today. We are talking about epileptic conditions and some conditions. And don't go without leaving a like. Leave a like. Do me a like. Just double tap your phone or give me a like on your screen. And then tell me where you are watching me from. Maybe you are watching me from the US. Maybe you are watching me from the African countries like South Africa, Kenya, Uganda, Tanzania, East Africa, Northern Africa, or West Africa like Nigeria. Tell me where you are watching me from at the chat. Tell me where you are watching me from, so that I can see which people watch me so much. It's good to interact and to talk about these things. So my guys, welcome to the channel. We are still continuing with generalized epilepsy, and we talked about generalized epilepsy. Some people had so many questions that we dealt with previously yesterday night, and you saw how it is funny that some people who are confessing they didn't know where these issues come from. Some of them were talking about myths. Here we don't talk about myths, we talk about facts. We talk about facts about health. So myths, we put them aside and we clarify. So if you are watching me, you are there seated at work, doing your work as you are listening to the flow of YouTube. Do what? Subscribe to this channel, my friend. Sometimes subscription can give you good notifications. Yeah, good notifications you get. And also, as you subscribe, like you see my friend Tendai Soko. Tendai, welcome to the chat. I can see you are the first one today. How is you doing, Tendai? How is the going, Tendai, where you are? How is you doing, Tendai? Hope you are good where you are. Your country is blessed and you are healthy too. So I'm just welcoming people, telling people that this is the best channel you can be, because we meet and socialize and we welcome everyone. Negativity outside, positivity welcome. So we talk about medical languages. You who is watching, I would just like to understand and know, where are you watching me from? Text me to the chat. Tell me where you are watching me from. Tell me where you are. Let's talk and interact. Let's get to know each other. Don't just scroll away. Sometimes when you watch a nice person like me, like Benjamin the Wise Guy, don't scroll away. Give me a like or a subscription, or tell me where you are watching me from. We always, I'm fine, thanks, ready to learn more today. Welcome Tendai Soko. So everyone who is coming and you are new, join me at the chat. Tell me what you would love to learn, which topic you would love to understand, which topic you would like to know more about. You get, there are so many topics about health, not necessarily about injections, medicine, but even mental health and social life is about medicine, because it makes your brain be settled and you stop feeling some issues that are not okay, and your health starts from the brain. So tune in, my friends. Don't go without telling me where you are. I like people coming in my channel and telling me, I'm from Sweden, I'm from the UK, this is what I would say, I'm from Africa, I'm just next to you here in Kenya. When you are told like that in your channel, what do you feel? You feel blessed and you feel fine. You feel everything is good, everything is nice. You see? So guys, welcome to this channel. We are talking about epilepsy. Epilepsy is a complication that has been there for so long. And yesterday we were going through the facts and fictions of epilepsy. Someone asked me, what is epilepsy? Why do people fall down when they have epilepsy? And I told them it's not a must that a person should fall down and have convulsions. No, some people get epileptic attack while they are looking at you like this for some seconds, and then they come back. That is epilepsy. It is still epilepsy. You check it out. So we are learning, my friends. And I would love to know, what do people say about epilepsy in your society? What do people say? I'm pinning that. Say about epilepsy. Yeah? In your society. What do people talk about? How do they say? What do they understand? What do people say about epilepsy in your society? Let me pin that. What do they say? About this thing, epilepsy? Welcome, my friends. I'm still welcoming people before I start. Before I start continuing with generalized tonic-clonic seizures. So welcome, my friends. Welcome everyone who is here. Welcome. Just watching and it's like when you're watching me, we are learning and we are interacting. So where are you watching me from, my friends? Which side of this world are you watching me from? I see my friend Epilepsy Lipenga here, a lady who is always charming, a charming lady, but sometimes she's shy. You know, shyness to ladies is normal. It's normal, and you see, it's good. So welcome Epilepsy to the platform. Welcome to the platform. The question that is rolling out Epilepsy is, what do people say? What do people say about what do people say about it's Chwea in Kenya? Which part of the country? Welcome Chwea. Let me welcome you first. Which part of our country, Kenya, do you come from? Is it Kisii or Migori or Kisii, Migori, Nyanza? That is Nyanza, all of it. Western. Chwea, welcome to the platform. What do people say about epilepsy in your society? Kisii community. Now, in Kenya, there is a community called Kisii. What do people say about epilepsy around Kisii community? What do you understand by Kisii about epilepsy? You know, everyone in the world, including the US and the Asian countries, all of those places, every place, they have an ideology about epilepsy. They have an ideology about epilepsy. So welcome, my friends. You know, my friends are here and they are welcomed. The only thing I've not given them are seats. I wish I could have seats. I give you, you sit down. Now, Sajay, this is called Sajay Cheshuja. Off. Saturday, are you a rapper? I can rap at times, Saturday. You just subscribe and go through my shorts. You will see where I have given you some rap form. Some rap form. Right now, we are talking about important things, Saturday, and we are talking about epilepsy, neurological condition of the brain. Very important. Sajay, I'm into rap and hip hop. Oh, Sajay is into Lore 44, wanna low, want the GZ, press out the jack to the jack, so the GZ. Sajay, I'm a doctor, but I can rap. Check some of my shorts where I've given some rhymes. I'm still welcoming people, Sajay. So welcome everyone. Sajay, have you subscribed? I'm from Sehoye region. That is Sehoye. Where is Sehoye? Yugoslavi region. Sehoye. Yeah. Benjamin, the wise guy. I need lessons from you. That's why I'm here. Very nice. Chwea. It is Chwea. I'm still welcoming. I have 1 minute to welcome, guys. So it's Chwea. What do people say about epilepsy in your region? Today we will, Sajay, please make sure you have subscribed to this channel and go and look, check my shorts. You will see some shorts where I've given some rap forms. So let's see my guys, let's see my friends, let me see what we are talking about today. Jamaican uncle in the house. Jamaican uncle, greetings to you, Dr. Benjamin, and everyone in the live stream. I'm doing some work outside and I'll be here watching, so I won't able to comment. Yes, Jamaican uncle is a bit busy and he won't be able to comment. So let's continue, my guys. Let's start the topic of the day. What is the topic of the day? The topic of the day is generalized tonic-clonic seizures. Tonic-clonic seizures. Remember, we did focal seizures. Focal seizures are those that start from a particular point of the brain, but these ones are called tonic-clonic. They are generalized tonic-clonic seizures. Previous called grand mal seizures. Previous called grand mal are a type of generalized seizures that involve the entire brain. Previously they were called grand mal, but now they are called tonic-clonic seizures. Tonic-clonic seizures. What happens during generalized tonic-clonic seizures? What happens? Epilepsy, generalized. Now here is where you get the convulsions. You get the real convulsions. You get, yeah, my friends who are watching me from the US, from Africa, from Asian countries like Philippines, China, Russia, all those tonic-clonic seizures, generalized, are type of generalized seizures that involve the entire brain. The entire brain is on a damage of electrical, and these ones are the ones which are bad. They can make someone to, you check. I don't want to say that name. That is not a good name. We need to preserve life. So what happens during generalized tonic-clonic seizures? What happens? Let's get to understand. We said a seizure may come from the temporal side of the brain, hitting generalized, and it's not even with rhythm, hitting right, left, and center without any rhythm. See, so sudden loss of consciousness may occur because the whole brain is in panic because of electrical systems that are not okay. Body becomes rigid and stiff. The body becomes rigid and stiff. Tonic-clonic. Jaw may clamp shut. You see, breathing may briefly stop. Possible blue skin, cyanosis, because the heart is not pumping blood as needed, so you have not enough air. These are called tonic phase. The tonic phase. Tonic means stiffness, but we have another term in the same, which is called tonic-clonic. When you have a stiff face, you fall down, you have a stiff face, then you start jerking. Now the jerking is called clonic phase. Jerking. Jerking is the stiff face. You know, the brain has 12 cranial nerves, and we talked about them. Let me name them as we continue. And when they are in panic because the electrical system of the brain is not okay, problems come out. Olfactory, optic, oculomotor, trochlear, trigemina, see, abducens, facial, glossopharyngeal, all those, vestibulocochlear, vagus, hypoglossal, and accessory nerve, and accessory nerve. Those are the 12 cranial nerves of your brain. So when there is a funny electrical system in your brain, the 12 cranial nerve that innervates whatever how you eat, how you swallow, how you do some things, becomes a problem. Let me name them again. Olfactory, optic, oculomotor, trigemina, trochlear, abducens, facial, see, hypoglossal, vestibulocochlear, vagus, we have. After that we have the other one, which is called accessory nerve, and then we have the glossopharyngeal, but they are not in order. See, those are when the brain gets the funny electrical system, they become confused and they send bad signals, and then you jerk off. You start jerking off, within jerking arms and legs, possible tongue biting, and loss of blood or bowel control, because the vagus nerve controls the abdominal area, but it comes from the brain. It's cranial nerve number 10. So if it is confused, The bowel even becomes confused, because the bowel is how food goes down your stomach. And that's why sometime when there is confusion and someone has stiffened, you start seeing some foam coming out of mouth. See, very important. This is a very important session when it comes to checking a tonic clonic. You see, we started by absent, generalized, and generalized seizures. For a person who is epileptic, we started by absent seizures, which were typical for short time and atypical that goes for long time. But another thing here, we have come and see we have something else, generalized, that is coming around your body from the brain, bursting electrical movements that are not correct, out and in. And when they are bursting, the focal areas are sending in signals that are bad. Maybe because of damage of your brain, and infection, meningitis, epilepsy that came because genetics had passed it on to you. You see, it starts forming another generalized. And generalized is, hi bro, J-Hank is here. J-Hank, big up. Yesterday I had some time to be on your live. I felt so nice finding you on a live that day. Thank you so much for giving us a good live. Although I left it running, I was heading home. So generalized, here is where you have the signals that are hitting right, left, and center. And then you get tonic and clonic phases. Tonic is stiffening, clonic is jacking off. Yeah, tonic and clonic. So in the stiffening phase, which is tonic, is sudden loss of consciousness. Sudden loss of consciousness, and the body becomes rigid. And when it becomes rigid, jaw clamps. Like this. You have seen a person going, and then breathing may stop because the nerve that is helping the heart, or the muscles, the muscles of the heart, they do contract and relax by themselves. So the accessory nerves, the nerves like the diaphragm nerve, loses the phrenic nerve, loses balance. And the clonic phase comes, the jerking after you are down, rhythm of jerking. So stiffening and then jerking can bite your tongue. Loss of bladder or bowel control. Someone just pees on the trousers, on the clothes, can even go long haul there. Now, when after seizures are done, confusion, drowsiness, headache. You may feel someone asking, what happened? Or he's just kept silent, looking what is happening around here, what is going on around here, where am I? Confusion, brain damage has led this person to have a confused state. Muscle soreness, feel your muscles are very sore. Seizures are a complicated thing. Seizures is no joke. May last minutes to hours. They may last minutes to some hours. You see, they may last minutes to some hours. A person often has no memory of the event. Once your brain has hit the ground and you are jerking, you will not have memory of the event. You may not have memory of the event. You see, you may not have memory of the event. Epilepsy causes of epilepsy are like brain injury or tumor. Epilepsy is most common. You see, these are seizures. Epilepsy is categorized by seizures jacking off, and that way. You see, so infections, meningeal infections. Meningitis always means meningeal infections, the infection of the brain meninges. The foldings are called the meninges. So the word meningitis comes from the inflammation of the brain meninges, and if it is bacterial and it is so high, what can happen, my good friends? Leila, greetings. Leo, the powers are gone till 5 a.m. Just passing by to live alike. Oh, thanks, Leila. Even this where I am, they had gone, but right now they are back. So thanks, Leila, for passing in. My sister Leila, who stays at Ngong. When I pass through Ngong, I'll call you. I tell you, come here. I'm in this area, but please don't send someone to hit me up with canes. When you go to some people's area, you don't go there and just start calling people. You have to request for them to adhere. See, when you go to people's place, you request for a meeting. We just not. Yes, we are talking about causes. Metabolic issues like low glucose and electrolytes imbalance. Alcohol withdrawals is another problem. So guys, let's not drink alcohol a lot. For those who are drinking, please continue drinking, because when you get problems, you will go to hospital and the doctor will tell you that is indiscipline, you are killing yourself. So thank you so much for continuing taking alcohol, and it's time to stop taking alcohol. If you take some, just know Dr. Ben doesn't love alcohol. For me, I don't like alcohol because I've seen they can damage your brain. They can do a lot. Even socially, it brings a very bad society. Alcohol and drugs, those drugs that are in the streets, you get? Now, fever, especially in children, can bring problems. Fever can bring problems to you. Fever can bring. And as we continue talking, my guys, my friends that are good and listening, please ask me a question. Ask a question. Let's interact with questions. Let's get to interact with questions. Now, sleep deprivation can cause you to have tonic-clonic seizures. Stress, flashy lights, and mixed medications. We have talked about this since that time. We have talked about this. Now, anyone with a question? Because I'm running so fast, I'm going so fast, but I want anyone who has a question. I'm going so fast. I'm giving a chance for someone to ask a question. It is called epilepsy. Let me ask now, have you ever met someone who has epilepsy? Because some people may not have met someone who has epilepsy. And it's normal. It is normal because, not some places, people have never seen some conditions, like sickle cell anemia, sickle cell complication is, you may find it in just some particular places. That one, you cannot find it in very many regions. Even epilepsy, some people have never seen. The first time a person sees these things, a person has been possessed. You may think that. Have you ever met someone who had epilepsy? Anyone in the chat? Okay, the brain normally works through controlled electrical signals between neurons. Excitatory neurons simulate brain activity, mainly using glutamate. You see, excitatory neurons. I explained about neurons. Some things, I'm using my hands, and they are micro from the nerves. So they exchange when the neurotransmitters like this. So they have a balance. If they don't have a balance, that's where you start having abnormal electric changes. Inhibitory neurons are called GABA inhibitory. They they stop the exchange. They inhibit the exchange, you see. And when they inhibit the exchange, you start having problems if they inhibit more neurons to go down. You start having problems. A seizure happens when this balance is disrupted and neurons fire excessively and synchronize. A seizure, the jerky movements and falling down, happens when you have Dorothy. Amekuja? Amekuja? The children. Now we're talking about the how it happens. A seizure happens when this balance is disrupted and neurons fire excessively and synchronously. There is no synchronization when they are jerking. See, this is where a seizure happens. You know what makes a seizure generalized? What makes a seizure generalized? Because we are talking about generalized seizure, this is not now focal where it is coming from one place. It is generalized. The whole brain is under ambush of problems, electrical system from everywhere. In a generalized tonic-clonic seizure, abnormal electric activity involves both hemispheres of the brain, the left hemisphere and the right hemisphere. You see, you know, your brain have hemispheres, left, right, down, the behind one, inside the midbrain, the pons, you know, all those, the midbrain. You got a medulla oblongata, the pons, you see, the hypothalamus. Betty, hi Betty, hope you are doing good. We are still continuing with our topic on generalized epilepsy or seizures. You can call it epilepsy or seizures. You know, epilepsy is when you are not having the epilepsy is a chronic seizure that has no control. But when we call seizure is that one episode. Maybe someone a child has a fever, high fever or an infection, and then you get one or two seizures and then you get better. But epilepsy defines without even a problem, you still continuing to have those problems of seizures because maybe it is a generalized moment of, yes, my guys, you learn. If you are learning, smile. If you are learning, smile. Let's learn while we are smiling. Let's learn while we are thanking God. Let's learn while we are feeling good from inside, my friends, good from inside. In a generalized tonic-clonic seizure, abnormal electrical activity involves both hemispheres of the brain, the right and the left hemispheres. It involves both hemispheres of the brain. Instead of staying in one small area, the electrical storm spreads out the networks in all the cerebral cortex, the thalamus, all the medullary, the midbrain receives that electrical system. The brain like you know how things go wrong. All electric systems. So they cover all the cerebral cortex, they cover all the thalamus. Connection between the hemispheres become a problem. And that is how we call it generalized. Thanks. And that is how we call it generalized electric moments. Hello doctor, how are you doing? Dorothy is asking me that. Thank you, Dorothy. I'm doing so fine where I am. We are talking about generalized what? Generalized electric episodes of epilepsy. So if you have ever met someone with falls down, becomes stiff fast, and then jerks, that one is called, let me take some water, my guys. That one is called That one is called tonic-clonic moments. Tonic-clonic moments. And most of the people who are epileptic, they have tonic-clonic because they are known faster than the ones who have absent. That is T Beauty. T Beauty, welcome to the chat. How is the going T? How is the going T Beauty? T beautiful. T is beautiful like her name. T Beauty. T is beautiful like her name. Welcome to the chat. T. Welcome Dorothy. Welcome J Hank. Welcome Betty. It's Chua from Qatar. My fellow Kenyan from Kisii, right away to Qatar. Tendai Soko. Welcome Sergey, a new friend of ours. Welcome all of you. We thank you. I'm tired. Just got home from work. Wow. Get some warm water, stay in the warm water and get some good massage. Get some good massage that will make you feel good. Yes. Welcome to the chat. Welcome to the platform. Good. Sometimes it is good to interact when we are learning. It is really good to interact when we are learning. And T, can you visit me? T, visit Dorothy. Dorothy is requesting if you can visit. Now, let's talk about cerebral cortex, the thalamus, connection between the hemispheres of your brain. That is the whole brain. And that's why people fall down and have jerky moments, involuntary movements that you cannot coordinate. You see, these tonic seizures are the ones which make people know they are epileptic. But the other one, which is absent seizures, people don't know. They are categorized in ways. So the absent seizures, people will never know. Before you are diagnosed that you are epileptic, it has taken so long. You see, it has taken so long. So let's talk about step-by-step brain events during a generalized tonic-clonic seizure. There is the first step. I had gone faster from the beginning, but let me go slowly. But if you have a question, please ask me if you have any question. And Betty is giving me some hearts. Nice, Betty. Thanks for those hearts. They are good. They make my heart go goo goo gaga, goo goo gaga. No, they are feeling good when you are appreciating. You see, that is why I'm saying you make my heart go goo goo gaga. Now, initial phase. Certain neurons suddenly become hyper-excitable. In your brain, the neurons, the nerve endings, they suddenly become hyper-excited. You start having excitement that in the brain that is not understood. And the possible reason can be genetic ion channel problem. The neurotransmitters are like electricity. They jump up, they suddenly miss and jump out. Or one day you had a brain injury and you formed a scar. So it is giving wrong electrical dimensions. They are not going straight and the way they are supposed to be going. Another thing is metabolic disturbances. Low sugar levels, high sugar levels due to some taking alcohol. Some people that take alcohol. You see, I put notification on your channel. Hey, yes, Dorothy, please visit Dorothy. She needs all of us. Now, drug withdrawal. You have seen some people who are used to drugs, hard drugs. We're talking about hard drugs. Yeah, the more they get it, and the more they want. Because when you take more, it binds to some things that are called dendrites. Dendrites are these of the neurons. So you feel that you are stable, but when you don't have it, the dendrites have nothing to hold them. So they give electrical systems that are not normal because you have been using drugs for so long and it has killed some dendrites. And you know, one dendrite can take up to 6 months, and we have millions of dendrites on your neurons to grow. That's why some people, when they have neuropathy or the problems when you are arthritis, Maje, doctor and classmates, Maje, welcome. When some people have taken drugs and destroyed their dendrites, you are given supplements. It takes so long, like 1 year, 2 years, you are just on supplements. And those supplements that you are taking, they are meant to make beauty. Hey, today we have two beauties, T Beauty and Beauty Simba. Hey, we are beautiful women in our house. Hey, welcome, beauties. My beauties, welcome. Mwah, mwah, mwah. Welcome to the chat. Let's learn as we feel good. We learn as we feel good. You see? Hey, beauty is telling beauty hello. Hey, that's nice. Beauty is telling beauty hello. So I was just saying this. Those drugs that you get at supplements, for people who feel burning sensation, the neuropathy, the people that feel neuropathy is the burning sensation on your feet, sometimes on your hands, extremities. Those people, let me tell you one thing. Their dendrites, some of them are destroyed. So why are you given the supplements? To make the dendrites grow. And why does it take so long? Because dendrites grow slowly. It may take years. And you give up. You say these drugs are not helping me. You've been taking alcohol all your life. Hey, coffee cakes, welcome coffee cakes. At Ben, I told you we're bringing back beauty back. We just need ugly now. Oh. We need ugly. Where is ugly? T, tell me any person who has ever accepted to be called you are ugly. Tell me one. This is so beautiful, Dr. Benjamin. Hi. Beautiful. Hello, Dr. Benjamin. Hi to the chat. Welcome. Now, we are talking about you have been taking alcohol for so long. You have been having an autoimmune disease like arthritis for all of your life. But you go to a doctor and a doctor prescribes to you supplements because the doctor wants the doctor wants what? The doctor wants the dendrites to grow. But because you are very anxious to see you recover, you want to recover in 1 week, you have been taking alcohol for 20 years plus. Tell me, my friends, tell me, even if the doctor is a miracle working doctor. Man, hey, sometimes I see things in hospital. I see things not good. Stay away from alcohol and stinky smoke. Yes, stay away. And you young ladies, stay away from smoking. Stay away from people who smoke as boyfriends. Just stay away. Stay smoking and then you get cancer. Now, you have been taking alcohol and now you have withdrawals. You have withdrawals and sleep deprivation. And then you injure your brain, you start having tonic-clonic. Because now, if your brain is injured right and left, what will happen? If your brain is injured right and left, you will start having tonic-clonic sessions. And that one is generalized seizures. My friends, welcome. But now, I want to repeat again. We have two types of, let me just be in consensus. The way lawyers talk. in conscious. This is the conscious now. We're talking about epilepsy. Epilepsy is categorized into two. Focal and generalized. You see? Now, in focal, have divided into two. The focal can be medium or moderate. You see it? And then we have the other one, which is generalized. Whereby in generalized we have absent seizures. Yesterday we talked about absent seizures divided into typical and atypical. And then today we are talking about a generalized session of epilepsy that is categorized into tonic and clonic. We have myoclonic as a generalized, atonic seizure, and tonic or clonic seizures. So you see, so this is how we categorize these things, my friends. And this categorization, they help us to manage the seizures, the epilepsy themselves. So let's not take drugs and alcohols that are giving us bad. Let's talk to our children. If you have your child and you usually take one for the road as the child is watching, now it's time to tell your child, as I'm taking one for the road, look at what Dr. Ben is saying. Look, don't be like me. But how can a child not be like you and is your child? He knows you are the best uncle, you are the best auntie, and you are telling the child, don't be like me. Where in this world, my friend? Where in this world can that happen? We get inheritance from our good aunts, our good uncles. So let's just be good people and avoid things that can make us have problems. And he watching you. T, yes, I was watching you doing. They tell children, some people tell the children that, these things are for grown-ups. So when a child grows up at 20 years, now this child knows I'm a grown-up. He'll start drinking and telling the other generation, these are for grown-ups, not children. Water is life. And they will continue telling that, and the generation will continue drinking. So if you come from a drinking family, you have to stop the generation telling others this is for grown-ups. You wait until you stop that. Very naughty. naughty. So you are talking about generalized, which is a part which is called tonic-clonic seizures. Tonic-clonic seizures, and we have talked about the tonic, the jumpy, the myoclonic, the people who have problems with you see, we have talked about absent seizures, and you have seen how they, let me see here. So let's talk. What do you think about, there is a question that I've posted there. Where in your community, what do you think people talk about these seizures? So we have seen how the initial phase starts, rapid synchronization. Normal neurons are now in the brain fires independently. Normally neurons, they start sending signals in your brain independently. There is something that is, I know someone will tell me that's a hard word. Don't feel it is. It is called thalamocortical circuit. The thalamus and the cortical circuit, the part of the brain that is called thalamus and the cortical circuit, spreads this activity widely in your brain. Now, in the tonic phase, the whole body stiffens, lost consciousness, and chewing, crying sound from forced air through vocal cords. Because every nerve from the brain is lost control. But in the clonic phase in the brain, clonic is jerky moments, like you are your hands are going, your legs are being jacked up, you're throwing your arms, you're jacking your legs. That is called the clonic phase. The rhythm alternating excitatory. You get GABA, the GABA is stopping and the other one is releasing. It is about the neurotransmitters now. We have talked about the main inhibitory that make you relax is GABA. So when GABA is being released, you want to relax. But the other one, the excitatory phase, glutamate is released again, because now these are signals. You jack off your hands and the legs. This is why you feel people doing, because in your brain, when you want to relax, GABA is released. It's inhibitory. When you want to walk and run, what is released? Glutamate. So now they are being released randomly without any form of, Dr. Ben, our children, they don't buy that story. They are drinking like there's no tomorrow. Well, these children needs me. They need I get a cane. You know, when we were in high school, even in high school, in primary school, we used to be caned, boy. Hey, sometimes we used to be caned until we run from school and go home, and then your parent turns you back to go back to school. These children of nowadays, just try and cane a child. The child will take you to Human Rights Commission. Children rights. Now, they need to be, you need to forward them my link. I make jokes about them until they stop the boat. They stop the boat. Now, we are talking about how the jacking and throwing of the legs and the arms comes in. This is how it comes. There is this, in the neurons of the brain, there is this neurotransmitter, the chemicals that are called glutamate. So when you want to run, when you want to dance and shout and feel, dopa is released and it releases glutamate again. So that one is called a stimulant, neurotransmitter. It is called a stimulatory neurotransmitter. But when you want now to relax, you are tired, you want just to sit down, take your coffee, like our friend, the coffee cakes, and feel nice. You check it, You feel when you are feeling nice, you don't have anything that is bursting in your head. Your GABA now is released, and GABA, what it does, it inhibits, it suppresses the excitatory, which is called glutamate. But now, when the abnormal electrical function is happening in your brain, the abnormal electrical function now, when you are releasing everything, the brain is not under control. GABA and glutamate, they are released at the same time. So as GABA is forcing glutamate to go out, glutamate is coming out, the same brain, and that's why we call it excitatory and inhibitory what? An excitatory and inhibitory moment. And that's why in epilepsy you will always see the jerky moments, and then the jerky moments, and the sometimes stiffness, which is clonic. You see, because now the neurotransmitters that are in the brain, they are kind of like pushing the other side. But it should be gradual. When GABA is coming out, it's coming gradually, while it is inhibited, is suppressing glutamate slowly. Now, glutamate should also come out slowly and inhibit GABA. But in epilepsy, it is the opposite. They all comes out and then it becomes a bomb. It's like when you are taking a live wire plus a live wire and jacking them out, it becomes, so that is why we call them tonic clonic seizures, jerky moments and stiff moments, because you have no balance of the electrical system in your brain. So the initiation phase, when it starts is genetic ion channels problems, scar tissue. Those ones are the problems. Because where is my brain? I have an uncle who loves alcohol and a bit too much. How does he tell you a tea? How does he tell you about the alcohol? You know, people, those people that love alcohol so much, they have an explanation. Yes, there is something I'm drawing here. I want you to check. I want everyone to understand my ideology of the brain and brain function, which is very important. If you have a question and you don't want to be left behind, you ask. Drop your question in the chat and ask. Now, look here. This is your brain. And you see, the brain had a problem somewhere here. Well, I got results and everything. Every time is tipsy. Okay. This is a scar tissue. Maybe your brain was injured sometimes back and it formed a scar. So when the electrical systems are performed, the electricity is moving through the brain meninges. It reaches here and diverts, crosses the wrong dimension. So it crosses across the meninges instead of going straight. So the others are going. So this one we'll talk about, we'll tell you this is a focal point. So this one comes from focal, not generalized. But if this is even in the other side, let's say you have a scar on both of the meningeal brain, both brains, like this. A scar, both. Another one is this side. So as this one is releasing, this one is passing it. That is called generalized. And most people that have injuries on both hemispheres, they have tonic-clonic phases. And that is a very big problem, because scars in your brain, you cannot, even surgery cannot help. You just have to wait and get. There are some people who have tumors. You can find a tumor is growing in the brain and starts to press these meninges. So it will having improper sending of electrical ions around your brain. And you see, this is a very bad thing. You need proper. They need to go simultaneously. If GABA is coming out, glutamate is going in well. You see? Very important when this balance is there, because it's the balance of life. It is the balance of life. Brain cells begin firing rapidly and unconditional. Rapid synchronization. Normal neurons fire independently during seizures. Now, the tonic phase in the brain. The tonic is when you are stiff. Why do you become stiff? Sustained continuously neuron firing. This is a phase that those neurons are firing so faster that you cannot even have a second of rest. So you become stiff. Massive activation of poor pathway. Like if this one has started, it is now pushing the neurons directly. It's hitting this scar, and the scar is pushing this side directly. It's hitting this instead of them going like this normally. So you'll find this person will be stiff. The motor cortex sends non-stop signals to the muscles. GABA is being released and glutamate is being released at the same time. So they are sending direct informations without any stop. You see, the whole body muscle stiffens. Loss of consciousness comes in. Jaw clenching, crying sound from forced air through vocal cords, because now even the muscles that control your vocal cords are having a problem. Why consistent? Someone may ask, why consciousness is consistently loss of consciousness is there. Why do you think so? Now if your brain is jerking out right, left and center, what do you think? The nervous system, it is called reticular activity system. The reticular activity system is not working. So you will have a problem of being conscious. The consciousness, you being conscious, I remember Onik once asked about what happens to people when they are having a coma or unconscious. There is this thing called the reticular activity system, the reticular in the midbrain, that balances your consciousness. It breaks down. So when it is about a short time, acute, like you lack oxygen in your brain for some time, that one is understood. The reticular comes back when oxygen is, but when it is in a coma, you can do nothing. That's why people are put in ventilation to give oxygen. People are put in ventilation to give oxygen and wait. Maybe this person the brain itself will excite itself, and a person becomes a garbage now when he's put in ventilation for so long and nothing is happening. And you've heard stories whereby a person now, the family is called and told, should we continue to put this person on ventilation or should we remove? Because now the brain is not recovering by itself. You cannot make the brain recover. We have to opening the brain, you can damage everything. So the facts are left for them, the family. What about the clonic phase in the brain? Clonic phase is whereby you are jacking off, I've explained it. The neurotransmitters are the ones which are beating up right, left and center, the neurotransmitters. And the fact why is because both parts of the brain are involved. And you can get there if you have scars in your brain. The second thing is if you are taking alcohol and you have got somewhere electrolyte imbalance. If you are diabetic and you cannot hold it anymore, you are not taking your drugs, you end up getting into a state called diabetic ketoacidosis or hyperosmolar state. Diabetic ketoacidosis or hyperosmolar state. Then you pass out. You see, you should take your drugs and you should always go to visit a doctor on checkups when you are diabetic or you have a chronic disease like hypertension. You see, there are sometimes breathing changes in this tonic-clonic phase. I've said tonic-clonic phase is the most known from people. It is the most known of epilepsy that people know, that people understand. So you may find that you have a problem when it comes to this point. So if you have a question, please ask. Don't just listen and stay with your question. Let's get to talk. It's an interactive session. Yeah? Why do breathing change? Several brain areas controlling respiration becomes affected because the jerky moments is all over the brain. You know the other one that is focal, it is involving one point. And that's why we say breathing does not stop in focal epilepsy, because one point maybe may not be affecting the breathing centers of the brain. So you find someone has just lost directions, stood stiff, watching like this, and then comes back. But in this generalized focal tonic-clonic, you will find that sometimes breathing may be affected because the whole of the brain is involved. And when the whole of the brain is involved, what happens? Some other centers are involved. So the centers of breathing are involved. The brainstem respiratory centers, medulla oblongata, the pons, the thalamus, the brainstem itself is affected. And chest muscles becomes rigid because the centers of the brain they control the phrenic nerve that goes to the diaphragm. So it becomes stiff. This can cause temporary apnea and cause bluishness of your body. The palms, the legs, the eyes become blue because when you lose oxygen circulation in your body, what is there is bluishness. You become blue. The hemoglobin, when it is having oxygen, it's red, bright red. But when it loses, it becomes blue, the hemoglobin. And that's why you find some people are pale and blue when they don't have enough hemoglobin. Breathing usually returns afterwards. Let's talk of neurochemistry involved about breathing. Main neurotransmitter is called glutamate. Too much glutamate activity increase neural firing. Glutamate is released and then electrical system go way high. Yes, and the GABA is reduced. The main inhibitor. So GABA is reduced. Reduced GABA activity allows uncontrolled electrical spread in the brain. May enter into seizure. Many anti-seizure drugs work by. So when you give something like phenobarbital, it enhances GABA to come out. So this is how those drugs work. It enhances GABA to come out and reduces glutamate. Because now glutamate, when glutamate is out, it fires like machine gun. I tell him, stop drinking that poison. Say, little girl, you don't tell me what to do. You are still a little girl. And that is what they usually say to T is saying, I told him to stop that poison. And the answer was, little girl, you don't tell me what to do. I'm an elder. So you just let me take the drink. Yes, when you don't like that, you can't say anything. You start sending your uncle links of such kinds of talks. Because you are a little girl and you care, stop irritating uncle. Send your uncle links only. One day he'll open, and as we talk, he'll be redeemed. Yes. Now, we have been talking about the receiving and the sending end of. This is why when you give phenobarbital, when you give the anti-seizure drug, diazepam, some of them they reduce the control, the release of glutamate, because glutamate, when it's released, it fires so much. There should be a balance, and they enhance GABA coming out of your brain, because GABA enhances relaxation. You see how these things work? If you understand, you can prescribe. If you don't understand, you have to be prescribed. And that's how we prescribe to our patients. Dr. Ben, someone said, if I drink, I will die. And if I don't drink, I will die. So should we drink and give our bodies problems before we that is just a question. Should we drink and give our bodies problems before we die? Or we die when we have enjoyed our bodies? Think about it. But there is a question there and asked. I want to mix out there. I want to know the myths out there, the myths about societies, the myths. I want to know the myths out there. What do your society talk about epilepsy? No one has answered. I've pinned that question and no one has answered it. What do your society talk about epilepsy? So it is open. Smiler is just saying that for justification. I realized most people that drink with indiscipline, they are hiding behind the bottle because they are hiding something. And when they are drunk, you will once know when they are really drunk. They will give you a hint one day when they are drunk. No one drinks with indiscipline. No one cannot take a whole crate of 24 plus 30 bottles and then you forget to go in your home. you sleep outside, or you pee on your trousers, or you start insulting everyone. There should be something that is hidden that is making you be indisciplined. And someone knows that. Yes, someone knows that. Many people drink and they discipline themselves. And you will never know these people drink alcohol. Some people smoke marijuana, and you will never know those people smoke marijuana. Ask me. I know. I know. But if you find an indisciplined drinker, an indisciplined person who smokes and insults people, it is not that stick. It is not about that bottle. It is something hidden behind those two. Find out. So that one was by the way, ion channels and ion scissors. Neurons depends on ion channels for electrical signaling. So sodium, calcium, and potassium. There is something called sodium-potassium pump. These sodium, calcium, and potassium pump, they lose direction. So you may find more calcium that is going inside cells. And when we say it, when more calciums are going inside a cell, what happens? Constriction happens. Potassium, all those lose balance in your brain. So you lose the normal balance in your brain, and you start having jerky moments always. So today we were talking about that. This is called tonic-clonic, and I'm trying to explain how it comes. I've really tried. Why the body jerks violently? Why? The motor cortex repeatedly activates spinal motor neurons. So from the brain, the ones that are called the ones that are T, especially the men. Hey, Vajay, I don't know how to respond to that one. Now, from the cranial nerves, you have the spinal nerves, the axillary spinal nerves. So the brain controls the cranial nerves and goes back to the motor cortex, where it stimulates the spinal nerves. The skeletal muscles becomes problems because the spinal nerves, the spinal cord of your back down there, controls the muscles, and when they are jacked off, you become stiff. Since both hemispheres are involved, movement affects both sides of the body, all of the sides of the body. You see, it becomes a problem. I think this issue of alcohol is bringing problems. I've seen what they saying, especially men. So if you are a man and you are here and you are drinking, check on yourself. Check on yourself. But someone told me nowadays women drink a lot. Is it true? Is it true? Is that statement true? Yes, maybe. Majay, wow, here too in Alaska, the natives up here, they can drink. The natives, because they have no, I thought the natives are tea. I thought the natives are into farming a lot. So maybe they farm wine, berries for wines, corn. So they are not into drinking. So it means that the natives are more into drinking. There is a phase in epilepsy that is called postictal phase, post-ictal phase. Sorry, post-ictal phase. The post-ictal phase is after the seizure. Post-ictal phase is after the seizure. Is that because women are more stressful than men? Dr. Ben, come to SA, you'll see wonders. Beauty, I always see, I always see wonders there. I see them online and I want. SA, South Africa is something else. It's party after party from Monday to Monday. Then people get medical issues. Is that because women are more stressful than men? No, someone just told me, but even the research says so. No dull moments. You wake up in the morning and you find people outside your house are dancing with alcohol. That was used to happen in the villages of Kenya some time ago. And you see that is a case of mental health. That is a mental health issue. And nowadays I think it is controlled by the government down there, the areas, local governments around there. Smiler in the city, I think so. The country nowadays, more women are not married, more are single. It makes sense according to the research. It makes sense. But we have women around here. Let's hear him. If it's the truth or we are having our own assumptions. If you are a lady and you think that assumption was the research was not okay, tell us. The research was not okay. Tell us. More women drink a lot nowadays. Now, post-ictal phase, they may kick me out of their country. After the seizure, post-ictal means after the seizure. Post-ictal means after the seizure. Neurons becomes exhausted. Brain metabolism is temporarily impaired, and the cerebral blood flow changes occur. The cerebral, your brain should have oxygen and nutrients, and we have cerebral blood flow through the arteries and subcapillaries. So after the seizure, neurons become exhausted, they are tired. That session of jacking out and jacking off is a very hard session. Brain metabolism is temporarily impaired, the brain metabolism, and cerebral flow changes. The way the blood goes to your brain because of the of the constriction and jacking off, the blood changes. This leads to deep sleep. That's why someone, I think Maje, you told us there is a person when you, after the incident, this person sleeps. Now that person had tonic-clonic seizures, and now you know why that person had tonic-clonic seizures. Deep sleep, confusion, headache, muscle soreness, and temporary weaknesses. And you can see some brain changes when you put this person on an EEG. The EEG that is, you put the knobs on your head and you see the electrical system on an LED display. You will see generalized spikes and waves discharge. Spikes, waves that have gone up, way up and down, and post-spike activities. Post-spike activities are waves that are trying to settle down. They are going like this, the up one. They are just like the ECG of the heart. So you will see some up going down. That one I'll show you one day when I have that machine. If you have been ever done an EEG or an ECG, you know that machine. Joriam is here. Joriam, where did you go to? Joriam is here. Now, diffuse slowing afterwards. Diffuse means recovery phase. It recovers so slow with some waves that are looking so tired. I'm just here. Yes, people, my students are very funny guys. Joriam Technologies. So, long-term effects of repeated uncontrolled seizures. Long-term seizures of uncontrolled seizures. What can happen if these seizures go for so long without being untreated or controlled? I've told you how the drugs that we use work. I've told you how the drugs that we use work. How do they work? Those drugs, they work by inhibiting some neurotransmitters. So GABA and glutamate. The one that is inhibited is glutamate because it's the one that fires so fast, and then they excite coming out of GABA, which is the relaxation that brings relaxation. So long-term effects of uncontrolled seizures can lead to memory problems because they are destroying the memory parts. You see, they are destroying the memory parts. Cognitive slowing, mood disorders. Cognitive slowing is you are reasoning so slow, and before you do something, you have to take time before you do it. Your reasoning becomes impaired, and when your reasoning becomes impaired, problems are underway. When your reasoning becomes impaired, you get problems that are underway. Mood disorders, just like the people who have neural tube defects, autism and ADHD, there we have it here. Neuronal injury in severe prolonged seizures. If your neuron is injured, you will have problems. Balance problems, how you think, how you reason, how your character comes a problem. So we give these drugs to balance so that they cannot give the neural problems of impairment. We don't want people to have neural problems. You get? We don't want people to have neural problems. Joriam, are you sick or what is happening? Why are you sending emojis saying that you are sick or sad? What is happening on your end? Joriam, what is happening on your end? Do you have any problem that is undergoing that we can help? Okay, we have talked about these conditions, and they are very important conditions. These are important situations and conditions. The brain structures that are involved in this are cerebral cortex, thalamus, corpus callosum, the brain stem. The brain stem is the one which affected during consciousness and breathing changes, because the brain stem is the one which helps you in breathing and doing what? The brain stem helps you when it comes to breathing and consciousness, the brain stem. But there is a part of the brain that is called the corpus callosum. The corpus callosum allows spread between the spread of electric hemisphere between this side to this side, the electric spread. Thalamus helps synchronize Caesar's activity. They help synchronize Caesar's activity. That is the thalamus. And you know, thalamus, of course, it is involved even in balance of some things like water balance and so much. The hypothalamus, you get the lower part of the thalamus, generates abnormal. The cerebral cortex is the one which produces the electrical activities and can generate abnormal electrical activities. You see, so that is how the brain works. And now we know why some people have tonic-clonic. The most common seizures, the most common seizure or the most common epileptic episode that we have is the one that we have just covered, which is called the tonic-clonic seizure episode. The tonic-clonic seizure episode is the one that we always have. So if you can like have a tonic-clonic episodes, you need to get some drugs like phenobarbital, and these phenobarbitals will do what? Will make you have more GABA in your brain. When I'm saying inhibitory and excitatory is glutamate. Excitatory is the neurotransmitter, is like a chemical in your brain that makes you be active, do things hard way, feel laughing, jumping out, you know, the excitation. It is called excitatory. So when it is released, someone becomes so active. The brain releases it and you become so active because both of your body becomes, and adrenaline comes out, you know, dopamine comes out, and then you are alive. Sorry, this boyfriend need to go take a nap, messing up the lesson. Okay, T, I hear you, T. But the other side, the one that inhibits, it's called GABA. GABA is called GABA. You see, GABA is the one that makes someone calm without problems. You see, without having more problems. So when you are alive, you've been dancing and now you want to just chill, your brain releases GABA to take control. GABA is brain main inhibitory neurotransmitter. It is called gamma aminobutyric. Natives here, they love alcohol. Okay, aminobutyric acid. It is called gamma aminobutyric acid, and when it is released, you slow down. It slows down the nervous system, prevents overstimulations, and maintain the balance in the brain signaling. It is like the brain breaking off from all the excitatory moments that you've been having and every excited period that you've been facing. Without GABA, what will happen? The neurons from the nervous system, from the brain, will be firing without any control. Those people that are hyperactive, they don't have enough GABA. Your brains don't release GABA as it needed. It is called hyperactive complication. Seizures, anxiety, tremors, and sleep problems will not be there. Without GABA working with melatonin, you will not sleep. You will always have sleep deprivation continuously. Sleeping, you only sleep 30 minutes and you're up 10 hours, 12 hours to 23 hours. Because you lack GABA. So GABA is released. It binds to GABA receptors on the nearby neurons of the brain, and it makes the neurons less likely to find. You see how this topic is nice. This topic is so nice, right, guys. So it is time for you to ask me questions. Anyone who has a question, today we have been answering questions of alcohol a lot, and plus it's called so that how people deal with it. Alaska have the highest suicide rate in the US. Oh, Alaska, because it's so cold, and sometimes when it is so cold, people don't go to work. They stay without working. They are just there, fighting cold. So anyone who has understood something, but you have not told me, guys, there is a question that I've pinned there. What do people say about epilepsy in your society? That was the question. Depression. Yes, they are so depressed. Cold is equals to depression. People that are depressed, depression is something else, my guys. Depression is something else, my guys. Depression. So what do people say about epilepsy in your society? That was the question, and no one has answered it. Or you don't know what epilepsy is, or you have never met epilepsy. You know, maybe someone has never met epilepsy, and I'm talking about epilepsy. So tell me guys, what do people talk about? Anyone can answer that question. Anyone can answer that query. I want to see what people think about epilepsy where you are. You know, I've talked a lot until there is a person who was asking if I am Arab. If I am Arab. So anyone who can answer that question? Anyone in the house? What do people think about epilepsy in your society or where you stay? In my society, more people ignore because they don't know how to process that. Yes, that is quite a good answer. That is a very good answer. Most of the people ignore because they don't know how to process, and that's where now we start having myths. You know, when people don't know how to process an if, it becomes Omar from Egypt. Hi, hope you're doing good. How is Egypt, Omar? Hope you're doing good where you are. Now, if you don't know how to process an event, that is where now we start coming with problems of myths. You get, you start have myths in society because now people are exposed to things that they cannot explain, and you start having to say things like haunted. You know, boom, family, good morning, boom. If you're coming live, double tap, like, double tap, like, boom, family, welcome, Omar, welcome. And when I was a child, my neighbor's son usually had epilepsy. They put spoon in his mouth, and that was very dangerous. Maje, according to what we have learned, you now know it was a dangerous thing to do that. It was so dangerous to do that. Nowadays we don't do that. It is dangerous. Boom, we are asking the pinned message. What do people say about epilepsy in your society? I think some people have never seen a person under an attack or a seizure, a real seizure that is tonic-clonic. I think some people have never seen people in these situations. Because Margie has said, people don't know how to process such. It is even hard for them. Why is this person behaving like this? Why? Yes, Doc, I'm glad to learn that was dangerous. Yes, I've seen some people that are brought to hospital and because of putting something on the mouth, the jaw had a crack. So this person you have to give some anticonvulsants to cool down and straight to take this person to theater, because there is a nerve that is here and a blood vessel. If it is broken down, this person will never eat normally. So it's not okay to do that. Boom, 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 boom. Tell us, what do people say about epilepsy in your society? Not even boom. Where is T? T. Where is T? T, what do people say about epilepsy in your society? I've taught you a lot today, and it's time to teach me now. I want to hear about. I'm glad to hear about the myths. I don't really hear about that because you have never seen one person. Have you ever seen a person book? I thought it was one kind, but I now learned that it's more than one. Yes, in Generalized, we have just covered, that is Margie, we have just covered in Generalized 2, absence and tonic-clonic. We still have several. Tomorrow we'll be talking about another one. This is a very wide topic. We'll be talking about another one. Myoclonic seizures. Stans, hi, hola. Stans is speaking Spanish today. Hola. Welcome, Stan. You will teach me to speak Pidgin. You will teach me to speak Pidgin. I love it. Daktari, how are you? Only Mawira is asking. I am fine. Now only Mawira is here. Tell us, only Mawira, what do people say about epilepsy in your society? That is the question that I'm bringing on. T is responding to hola. Yes. How do people that is, I want to hear different opinions, because I know different societies have their ways how they respond to these ones. Only Mawira, good to meet you here. Yes, Mawira is working hard on fencing and the land right now. I saw him fencing. Only Mawira, I think some people will be afraid when they see someone having a seizure. Now let's start from that. Smiler, that is very important. How many people have ever seen a person having a seizure? That is the beginning. You know, we may be asking about epilepsy and a person has never seen anyone having a seizure. If you have never seen anyone having a seizure, please say yes. If you have never seen anyone who has a seizure, please say yes. Listen to this. It's quite frightening. Smiler, yes, it's quite frightening. I think some people, they say it's a curse or the child is not accepted in the community. That is a myth, and we know. Right now we know it, Mawira, and that is what African society and communities say. They always say it is a curse, and that child is not affected. Gamma amniobutyric acid. Yes, that one is the suppressant of glutamate, which is the main excitatory. That one is the suppressor, T. A gamma aminobutyric acid is the suppressor. It makes you calm. You see. Now, Stans, give us your opinion about that pinned message. What do you think about it? Only Mawira has said in their community, they say it's a curse and the child is not accepted in the community because of the way they behave. And we talked about myths. And the myths are the ones which are doing what? Making them feel so. So Smiler has seen one and saying it's so frightening. We always see several. But when you learn and understand on how to put this person in a recovery position, it becomes a normal thing. Okay. Stans has seen several, multiple times. Stans, did you put this person or you were afraid you ran away? Did you put this person in a recovery position? T-Beauty Doc can soon give us tests. Okay, Wazi. Okay, that's nice. That is true. That is very true. One day, uncle's best friend when he traveled to Nyambawanza, you do well, Mavira. Okay, yes. On contrary, in my community, you feel for them. Yes, Stans. That is very important because you understand what this person. You know, when you feel for them, you understand what this person is undergoing. Jassy, cute. Jassy. Guten Abend, Bruder. I suppose that one is saying hello to me. Cute. Hello, I'm fine. You guys will teach me languages. Hey, so what, Jassy, which language is that? The goats. The goats is here. The goats, hi, how are you doing, the goats? Hope you are doing good wherever you are. We are just asking this question. We have learned about tonic-clonic scissors. I don't want to introduce myoclonic. That is another long. I'll do it tomorrow. So I want to see how societies feel about epilepsy. This is Stan's Kitchen. I think maybe they are exposed to many Dutch. That's good evening, brother. Oh, okay. I will learn. I'm learning Dutch slowly by slowly. So that is good evening. Okay, I am learning. One word every day will make me perfect. That is Dutch. The goats, yes, I do. The goats is here. Where are you from? The goats. Where are you? So, the scissors, when you know, by experience, communities learn to do what? To manage them. But you'll see some cultures that are always pushing these people away. Some cultures pushing them away because they don't understand what is happening. You don't understand. Where is the goats? The goats, are you still here? The goats, are you still here? So if you understand something, you will you will work on it as it is needed. But when you don't understand it, now you will treat that person in a wrong way. Just as Mawira has told us, they say it's a curse. You will start thinking that this person has a curse. And in reality, it's not a curse. It is a neurogenetic problem. Neurogenetic is, I've said, any condition that is impairing, is coming with impairment of the brain, is called neurogenetic condition. You see? So it is very important when we are discussing this, because these tonic-clonic scissors, some people get problems in the brain and they die. And we want to save lives. We don't want people to die. We don't want people to die. So everyone who is here and listening to what I'm saying, don't confuse tonic-clonic seizures with absent seizures. You should know there are different types of seizures, and when there are different types of seizures, you can maintain these seizures with drugs according to how they come. And if these seizures come with infections or some nerve complication on the brain, what we will do is you will treat what has brought it. Now symptoms are, but T is saying, but when people have depression, some of them can't even tell. That's why it's important to be considerate when it comes to dealing with people. And please check on your family every day. Yes, it is very important to be checking on your family daily. Mostly those family members that they stay alone. Like one of my family member that is called T Beauty. I have to check on T Beauty because T Beauty likes smiling and laughing a lot. So if I don't call, maybe T Beauty smiled and laughed until she passed unconscious, and we don't know. And she's staying alone, and the boyfriend is not around. So be checking on your family, T Beauty, Cute Jassy, or everyone here that is watching. Hey, good evening, Doctor Bonus Josh. Hey, this time round you'll teach me all different types of languages, and I feel good when I'm learning. See, so how does that spell? Bonus Josh, or that spells like that? Bonus Josh. Am I spelling my things? If you are new to the channel, some people are new and they are afraid of telling me. Some people are new here and they are afraid of chatting. No, we are not bad people. My channel is a good channel where you can talk, you can discuss with your friends. So if you are, I don't know anymore with epilepsy. Yes, but T, have you ever seen a person with a seizure? Epilepsy is continuous seizure that comes in a period of 6 months. Like in a week, in 2 weeks, you still have seizures. Have you ever seen a person with a seizure? Have you ever seen a person with a seizure, T? Have you ever seen a person with a seizure? Now it is just I've just taught, and now this is another session. I'm giving you a chance of telling me what you are. So I even me as a dog, I need to get to know how outside there people believe in some things, so that one day when I'm in another country and I'm hearing of something, I'm not surprised that something is happening like this in that country. You can go to a country and you want to help and you do something that is wrong, but when you tell me, like the question that I've asked, what do you people feel about epilepsy in your country, it gives me an insight, so that even how I relate to some people, I can start to what can I say, to manage how I relate to some people, because I can do something. I can go to rescue someone in his country, and it is not needed in that way. At Mau Awi, hey, let me read this. Will I really read? Let me try and read this. Malo Awi Mai Oe. It means, how are you in someone? Okay. We are teaching ourselves some languages here. So people, welcome. Let's teach ourselves some languages. Like you go to a country where your elders are not greeted by handshakes. You cannot greet an elder by handshake. And I'm a doctor, a young doctor, with an elder person. And then I'm saying, hi, I'm Dr. Ben, and I'm taking a hand. Is a convulsion different from a seizure? Oh, that is a very good question. I love such kinds of questions. Convulsions and seizures. Yeah? What do we think? A person has just convulsed. First of all, before I tell you what it is, I'll tell you convulsions are different from seizures. Convulsions are different from seizures. You get? They are totally different. Convulsions are different from seizures. What do you think, my guys? What are convulsions and what are seizures? Coffee Cakes have asked a very important question. What is a convulsion and what is a seizure? Anyone who knows the difference? Anyone who knows the difference of convulsion and a seizure? Please come on, my guys. Anyone who knows? Before I give my answer, a convulsion and a seizure. What is the difference? Those two things are different. Convulsions are totally different from seizures. So what is the difference between a convulsion? Anyone who knows before I give, let's jack out, let's beat up. Convulsions seem to have the body flop up and down, like flop up and down. That is according to Coffee Cakes. Yes, answered part of the question. Convulsions are different from seizures. So tell me, my friends, what is the difference? Tell me what is the difference? I'm waiting for another person. No one knows. I'm waiting for one person to tell us the difference. Maybe someone is typing. I think Coffee Cakes is really, how can I say? A person who thinks, what do we call a person who thinks critically and deeply? A critical thinker. How can I call someone who is a critical thinker? A person who analyzes and thinks critically. I think Coffee Cakes is a critical thinker. And analyzer. Now, no one can give us. Okay, what I will say, let me answer it. A seizure involves the brain, electrical activities involving the brain, and ends up to jerky activities of the body. But a convulsion do not involve the brain activity. You can just have jerky activities of the body without the brain activity, because maybe a drug that you have taken, temperature is high, but it does not affect the brain activity, electric activity. But a seizure starts from the brain. The brain activity jacks out the whole body. Now, that is the difference between a seizure and a convulsion. Or I've not explained well. A seizure starts from the brain. Electric activities that are involving the brain. A seizure. And a Leila is here. Leila, nice one. And as the other way around, a convulsion does not come from the brain. The ones that we have like drug convulsions, the ones that we have like fever and then you convulse, most of them are body involved, muscles and nerves, but not the brain. So I have 2 minutes for any question. So what about the convulsions and come from fever? Can an epileptic fever occur as well? What happens to the brain during high fever? There are some the development of some release of some hormones or some neurotransmitters of the brain. When fever is so high, they are called prostacyclin, endorphins, and there is one which is very important. I remember it, I'll say. So when they are released, they tend to stabilize the nerves and the muscles. So you end up having a convulsion. You see, you end up having a convulsion. And there is this question is like to, so what about the convulsions from fever? That is the convulsion from fever. Can an epileptic seizure occur as well? Yes. If you are a person who have an imbalance of what we have said, an epileptic due to genetic, and then you have high fever, you will have the convulsion and it will end up injuring the brain. You see, it will end up injuring the brain. So you may again, and if you see someone who has a convulsion, those convulsions of fevers are not like the ones like of epilepsy, because most of epilepsy, they are jerky, stiff, and you end up having a foam that is coming in your mouth. But the other one is just a convulsion. Mostly if you are working in a hospital or you have someone you have seen, you will see they are totally different. One is stiff and jerky. So you get that the brain metabolism, because of the neurotransmitters that I've said, they are released from the body for inflammation. And then they find that the body is unstable, then you convulse. You see, so if you have high fever and you are a person who has epilepsy, it can excite convulsions, which can end up to be seizures, because the brain is attacked. The brain is attacked. So don't say that a person who is having fever is having epilepsy. No, that person is not having epilepsy. But if a person has high fever and is a person that has been having epilepsy, it can excite an epileptic moment. Because when you are convulsing, the brain is affected, and then you continuously start having the convulsion. You see, my dystonia is worse in heat and when I'm sick. Yes, dystonia is involuntary movement. So it can be excited with heat or when you are sick, because when you are sick, you release a lot of things that are called prostaglandins. And prostaglandins, they are a mediator of inflammation. That is why the dystonia continues, because all your nerves are undergoing now inflammation. You see, instead you start getting prostaglandins. That is the word I was. Prostacyclins, nitric oxides that are your blood vessels release nitric oxide for your blood vessels to relax. But when they are, yes, now I know, I do thank. And when you are releasing endorphins, they constrict. You see? No, nitric oxide is for constriction. The other one is for relaxation. You see? So that is what happens, and it is a very important session. Thanks for asking that question, the coffee cakes. Now, people, wow, fascinating. We understand the difference between convulsions and seizures. Seizures starts from the brain. Convulsions starts because of release of cytokines. Mediators of immunity are called cytokines, and they start random inflammation. The whole body starts getting inflammatory response, and then you start having inflammation, because when the heat is too high, you start having inflammatory responses, and the inflammatory responses, they lead to convulsion. It definitely leads to convulsion, you see. So that is how things happen in your body. That is how things happen in your body. Yes, any other last question? I'm coming. Let me relieve myself. If you have a question, please text it. Text the question there before I come. If you have a question, text the question there before I come. A cup of water. Niko tu hapa tu. Uko tu hapa. I'm coming. Any question, please put it there before I come. So I am back. People really need to take care about themselves and watch you eat. It's very important. Yes, it's important. That is very important. The coffee cakes has given me some cups there. I don't know if they are water cups. And there is no question right now. There is no question. So You know, as always, we always meet at 2 hours and a half from now to answer questions. So if there is no, it's water. Water. I usually have water here. So let's meet after 2 hours. I see there is no more questions. We answer those questions that are needed. Those people that have questions after 2 hours, come with them. Tomorrow is a day we will talk about myoclonic epilepsy, myoclonic seizures. This one was tonic-clonic. So the other one we'll talk about myoclonic, the one that involves myoclonic involves muscle seizures. So with good time and listening, thanks you all that have been here. Just ensure you've liked and shared to someone. Thank you, my friends. Bye bye. 2 hours and a half I'll be answering questions. I really makes sense.